Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and host of the Dean's Chat podcast. Today, we are highlighting the Podiatric Medicine and Surgery Residency Program at Katherine Shaw Bethea Hospital in Dixon, Illinois. Today, my guests are current residents in the program, and I'd like to introduce each of them individually. Let's start with the third-year resident, Dr. Alexis Martinez, a 2021 graduate of the Arizona College of Podiatric Medicine. Welcome, Lexi.
Hi, Dr. Jensen. Thanks for having me.
It's a pleasure. Thanks for being here. And second-year resident, Dr. Sara Kubick, a 2022 graduate of the Arizona College of Podiatric Medicine. Welcome, Sara.
Hi, thanks so much for having me.
You're welcome. And first-year resident, Dr. Cara Fontana, a 2023 graduate of the Shoal College of Podiatric Medicine. Welcome, Cara.
Thank you for having me.
You're welcome. Well, this is exciting because, on our Dean's Chat website, we actually have a whole section of just residency information. So I interview some residency directors, but oftentimes I do interview residents, and this is just a great opportunity for prospective students or students at the colleges to learn more about your program. So thank you so much for joining me today. So to get started, what I was hoping we could do is each of you could share with the audience your podiatric journey to date. And perhaps the best thing to talk about is where you went to undergrad, how you found out about podiatric medicine, how you chose the College of Podiatric Medicine that you did, and how you ended up at the residency program in Dixon, Illinois. Lexi, would you like to start?
Absolutely. So I'm from Oklahoma. I went to Oklahoma State University. I majored in nutritional science, and I knew I wanted to do something in the medical field, and I was looking at medical school. And so while I was at Oklahoma State, I shadowed many different physicians and different specialties. And I kind of narrowed it down to wanting to do orthopedic surgery or podiatry. The two surgeons that I rotated with of those two specialties, they really seemed the most enjoyable to me. And so then I decided, well, I really like surgery, but I love doing nerve surgery. I love doing, musculoskeletal surgery. I like wound care. And so that's what made me gravitate even more towards podiatry versus ortho. I love sports medicine. And so that made me narrow it down to podiatry school. And then I interviewed at several different schools. And whenever I came to Midwestern University, Arizona College of Podiatric Medicine, I loved it. I thought the facilities were so nice. There was so much technology that you all had. And then during my interview, I spoke to the person interviewing me, and they talked to me about how we do our classes with the DO students and how it was very rigorous material. And I felt like, I want my training to be difficult, and I want it to be on par with other medical programs, so I can get the best training to become the best surgeon that I possibly could. And so that's what really stood out to me. And so I was very excited whenever I was accepted there. And so then after that, in my fourth year, I rotated at many different residency programs during my clerkship. And my program really stuck out to me because one, we emphasize teamwork and leadership skills, and as well as, skin to skin surgery techniques. And so that was one of the biggest things that I felt like, the best way to come out of residency well-trained is to get hands-on skills as much as possible during your 3 years, because 3 years goes by very fast. And so I wanted to get as much training as I possibly could. And that's what I felt like KSB really emphasized. And so I thankfully got my top choice, and I've been enjoying it ever since.
Congratulations. So you said that in just a couple minutes, but it's a long journey, right? I mean,
yeah.
Years of college, 4 years of podiatry school, 3 years of residency. My hat's off to you. Congratulations, Lexi.
Thanks.
Sara, would you share with us your podiatric journey to date?
Yes. So I knew that I wanted to go into medicine. I wasn't entirely sure what direction I wanted to go in. I was an emergency room scribe all throughout high school and college. So I felt like I got a really good exposure to a bunch of different specialties through the emergency room. And so I knew medicine was the way that I wanted to go. And so I had chosen my undergrad degree of biology at University of Redlands in Southern California. And one day, one of my roommate at the time and I had saw a posting for somebody from one of the podiatry schools was going to come and bring pizza and talk about podiatry. And I was like, yeah, honestly, free pizza sounds great. Let's listen to what podiatry has to say. And I remember we're looking at each other throughout like this entire meeting, like, oh my gosh, okay, this sounds really cool. It's checking all my boxes. I get to do sports medicine. I get to do surgery. I get to do wound care. I get to have clinic where I get to see and have that relationship with patients. So it honestly checked all of my boxes. And literally that night I went and I called our family friend who's a podiatrist and I said, hey, can I please come shadow you? So kind of the rest is history with podiatry. As far as picking Midwestern, I had looked into the California schools and I was looking into Midwestern and DMU. And honestly, the second I was on campus and I got the tour and I was talking to everybody there, talking to current students, I was like, yep, this is the one. This is the one that I want to go to. And so thankfully I applied and I got in and I canceled all my other interviews. So it worked out great.
Well, I'm glad you did that.
For KSB, I was looking at programs kind of all over. I went to programs in LA, all the way to here in the Chicagoland area, and kind of just to mirror everything that Lexi said, I was just really impressed by the amount of teamwork that is here, as well as just the amount of procedures and just the variety that we get to do. Being in a rural hospital, we are exposed to so many things, which is fantastic. And I was so impressed with what the third years were doing. They were doing these really big cases, skin to skin, and I was incredibly impressed. And then the first years were also, I was there, I was rotating when Lexi and Rutchett, our other third year, were both first years. And I was just looking at them like, oh my gosh, they're able to do all of these cases as a first year. This is incredible. And I also got my first choice. So I was very, very happy with that. That's kind of how my journey happened.
Well, that's a great story. Thank you. So Cara, you also found podiatric medicine, and would you mind sharing your story with us?
Yeah, of course. So just like Lexi and Sarah, I always knew I wanted to do something in medicine. I went to Loyola University Chicago. I'm from the Chicagoland area. Went to Loyola University Chicago and was shadowing everything from physical therapy, occupational therapy, to all kinds of different medical specialties, and really didn't consider podiatry in the slightest. And then I started having foot problems and had to go to a podiatrist. And I was like, I actually kind of like that. And Loyola actually has in their, like, they have a pre-med program. They also have a pre-podiatry program. So they made it really easy to know what you need and what the podiatry field kind of looks like. So I owe a lot of that to Loyola also. And so then I started shadowing a podiatrist, and they were absolutely great, trying to talk me out of podiatry, talk me into doing anything else. And every time I left, I was like, I really just want to go back there though. So I really enjoyed that, like, even though I was trying to get talked out of it, that was still like what I wanted to do. And so that's how I found podiatry. And then Shoal College, I actually grew up 20 minutes from Shoal. My whole family is in the area. And so not only did it just kind of work out really well that way, but when I went there, I loved the people there. I think the professors are really passionate about what they do. They're passionate about teaching, about wanting people to learn. And so I really liked that about Shoal as well. And then for KSB, so I came here for my rotation, I believe it was May. So I was a couple months into that was still my third year technically. And after I left, I compared every other program to here, because at that point, like, this was my favorite place. Everyone, like both Lexi and Sarah said, everyone was super friendly. They work as a team. They really just want everybody to learn. And the skills that these residents had when I was here, I was like, wow, if I could do that, that would be incredible. And so I went everywhere else comparing it to here. And so it really was just great to end up here.
Oh, that's fabulous. Well, you all seem very, very happy, and I think that's wonderful. Let's talk about the 3 years of residency at KSB. And would one of you want to just start with, well, Cara, let's talk about the first year to start with. What's it like to come in as a new resident? I know it's probably really great to have Lexi and Sara to work with and your other co-residents, but share with other students and the audience what it's like to become a first-year resident.
Yeah, so it's very intimidating starting out. It's a scary transition, but honestly, everyone here made it as easy as they possibly could. I mean, I can't tell you how many times all of the upper residents, Lexi and Sara and their co-residents, reached out and just said, hey, like, if you need anything, let me know. I think every day before Sara leaves, she says, hey, Cara, do you need anything? And the director and the attendings here too, they all tried to make it as easy of a transition as it could be, which really is amazing because it is a hard transition. But the first years here, we spend 3 months on service and then 3 months off service. So me and my co-residents swap those. So I'm currently off service and filling in clinic when needed. And my co-resident Drew, he is on service doing surgery about 3 days a week and clinic those other 2 days a week. And then while on service, you're on call every other week.
So what rotations are you doing the first year?
So for right now, I'm on infectious disease, and then I'm going to medical imaging and anesthesia. And then if someone could help me out what the other ones are later.
Do family medicine, internal medicine. What else do we do? Neurology.
Mm-hmm.
And is there any other one, Sara?
I don't think so. I don't think so first year. Yeah.
Oh, well, very good. So that's a good model then. And so do you get most of your rotations done the first year, or Sara, do they carry into the second year also?
They also carry into the second year. So it's the same 3 months on, 3 months off is carried throughout the second year as well.
Okay. Very good.
Yeah.
How many attendings are at your program?
We're a pretty small program, but we have 3 main attendings at our main hospital, and then we have 3 in Rockford and 2 in Beloit. So what does that end up being? 8? I think we just added a 9th one too. So we will probably end up with about 9 total.
Okay, very good. So Sara, what was it like transitioning from first year into second year? What is that like in terms of your responsibilities?
Well, second year, we don't have any calls. So that was really nice. That responsibility was gone. I am in the exact same track that both Lexi and Cara are in. So I am off service for these 3 months. I'm currently on general surgery. But our main focus that we work on our second year is the surgical escape room that our hospital puts on, or that our program puts on, which is a really, really cool thing. We do it every year in the Chicagoland area. And Lexi, correct me, there was like 100 residents and students from 17 programs last year. It's a really cool way for all these programs to get together to work through cases. And it's kind of a nice, friendly competition that we put together. It's awesome.
So, I saw some Facebook posts about that.
Yeah.
That was just recently, right? A couple months ago or something?
Yep.
April.
Okay, very good. And so how'd you guys do in the competition?
So it's actually, we place everyone in separate teams. And so we have 2 winners, one from the first half of the morning, another winner from the second half. And it's about efficiency during this surgery that you're doing, how quickly you get through these puzzles that we place to get different instruments like a scalpel blade. And then we had to incorporate medical students. They were the only ones allowed to close at the end. So they were also graded. Each group was graded by how well they closed the incisions at the end, all timed. And so, yeah, it was a really cool way to have people compete, but also learn at the same time.
So it's like
we did not escape.
It's like a medical version of Survivor or something.
Exactly.
I like that. All right. So Lexi, You're a third year. What's the third year like? And comment about your confidence in surgery and patient care as you go through this transition, because 3 years goes by quickly, but it's still 3 years. It's a long time. So if you don't mind commenting on that also.
So in your third year, you spend 6 months at our main hospital, KSB, in the chief resident role, which is what I'm currently in. And then you spend the other 6 months at Morris Hospital with one of our other attendings. Oh, so there's 10 attendings total with him. You spend that. And it's almost like we try to make it like a mini fellowship, because you're his only resident. You're doing, you're doing his clinic, you're doing his surgeries. And it's really just time to figure out how are you going to manage a practice on your own. And so that's how we set it up. And so in your service during your chief section of the third year, you split call with the first year on service every other week. So that's where I'm at. I take call every other week for 6 months. And I think how we have the program set up is very well done, because each year brings on new challenges. So your first year, you come here, you kind of learn how to manage call, the inpatients, but it's in these 3-month chunks. And you're staying mostly with the attendings here, and they do all of our attendings are incredible, but the 3 attendings that we spend time with at KSB, they are just such wonderful teachers. And so they really prepare you for how to do surgery, how to manage clinic. And so that's kind of your main focus in your first year. And then you go to Rockford, which is about 50 minutes from where our main base is. And we spend time with the other attendings there. And again, another really great form of growth. You're mostly only doing surgery in your second year. There's not as much clinic time, but that is your time to really grow in your confidence as a surgeon, because here you've went from kind of going through the basics with these great teachers in your first year, and then you're going with, some really incredible surgeons up in Rockford doing some really big recons. And you learn you start figuring out what you like to do, what your preferences are, because you've seen how one way to do it is, and now how the other way to do it is. And so, I think my confidence grew a lot throughout second year, because it takes you out of your comfort zone. And so then you come back to KSB in your third year, and now you've been put into this leadership role, and it's, it brings on its own challenges that here you are now chief, and there's people that are looking up to you, but it is a great experience, because now we're kind of getting back into that comfortable zone, but we're now expected to manage the clinic as if it was your own practice as well. So the attendings really want you to show up being well prepared for the clinic schedule, and also be able to tell them, this is what I want to do surgically for these patients. This is how I would do it. And this is, my stepwise approach for surgery. And they really want you to take it as if these are your own patients, and they'll guide you along the way, but you are expected to have autonomy in your third year. And I think that it's definitely prepared us well. I still have a lot to learn. I'm looking forward to having the rest of my third year of training. I think I would definitely not want my training to go by any quicker, even though residency brings on its own challenges. I've enjoyed every moment of it. And I'm very thankful that I ended up at the program that I did, because I think I'll be well trained by the end of it.
That's great. You had mentioned you also go up to Beloit, Wisconsin. Do you need to have your license in both states?
Yes.
I figured you would. All right. Very good. So let's talk about, or let's actually direct the discussion towards students and kind of our target audience, right? Because you really want some great students to come through the program. So what is the clerkship program like? And if you could outline the month when a student comes there, that'd be great. Cara, would you like to do that, or Sarah?
Yeah, I can try, and then Sarah can jump in when she feels she should. So students, depending on how many there are that month, it kind of changes a little bit. But for the most part, the students kind of follow where the first years go. And so we have surgeries generally Tuesday, Wednesday, Thursday. And so students will typically come to clinic Mondays, and then Tuesday, Wednesday, Thursday go to surgery if there's surgeries. And we like to have them participate as much as they can. And then Fridays back to clinic. And every Wednesday we do academics, and love having the students in academics also. Sarah, anything you want to add?
Yeah. We try to make it, I guess, as interactive and as hands-on for the students as possible. Because I know it's very intimidating as a student to be transitioning every single month. You're getting used to new people, you're getting used to a new place, and it's mentally and physically, it's draining. I mean, we've all been there. We all kind of remember what it was like to be a student. We do provide housing at our program, which is a nice bonus. It's very close to the hospital, the shortest commute I had as a extern. We kind of try to work with the students about, is there something that you want to gain from your month here? We're going to be spending at least 4 weeks with them. What do you want to get out of it? Do you want to work on, maybe we can build like an X-Fix frame, or do you want to work on your AO principles? It's nice because I feel like as a first year when I was going through this, and like Cara had mentioned, the first years are in charge of the students. I know that I learned by teaching. And so it was really nice to be in that role of teaching and interacting with the students and working with them kind of on what they're looking for in the program as well. We do require our people to interview who are going to interview at our program to either rotate or at the minimum, or do just a little, like a visit, just because we want to make sure that, we know you and you know us, and see how you kind of fit in with that team. Dr. Martinez, or you add anything to add?
I have a question.
Oh, yeah.
So you said you have academics on Wednesdays. What do Wednesdays look like for you? Different types of academics, or how's that structured?
Yeah. So every Wednesday afternoon is our protected academic time, which is really nice. We have a schedule that we follow throughout the year, which is super nice because at the end of each year, we will have gone through every single topic that we will see on boards. So by the end, when we're graduating, we'll have gone through it 3 times, which is really nice. It's very helpful. And so we kind of try to structure academics around preparing for boards, as well as hands-on labs. So usually at least once a month, we will have a cadaver or a sawbone lab. And then the rest, we do journal club once a month. And kind of in between that, we're either having the first year, we'll do a literature search, and we'll present on current literature that is out there, the off-service first year. And then the second years, we'll present cases kind of pertaining to what the topic is for the month. And we'll talk through, like my job right now is to present a case and say, talk through the steps of how you would do the surgery step by step, what instruments you're going to use, what is the patient positioning, everything. And then third years really focus on kind of structuring it like our boards is going to be focused. So it's a very in-depth academic session, but I feel like we really get a lot out of it. And it usually ends up going a little bit longer because we all get really excited and really into it.
That's fair enough. Well, it's great that you have structure to it too. So you know what you're going to be doing. And like you said, going through it 3 times ingrains it. And, it's interesting because the more you know, the more you get out of the lecture. So when you get it the first year, it's not the same as the second and the third year. So that's great. What you said was interesting. You provide housing for the clerks.
Yes, we do.
Does that include food too?
We have a couple meal cards that we provide. We as residents get free food from the hospital, which is really nice. And actually the food is really good.
That's great. That's a huge draw because, whenever you're scheduling your year, my gosh, on the 4th year, you're traveling all over the country, you're looking for housing, you need vehicles. I mean, it's not only is it time consuming, but it's expensive. So that's a tremendous advantage. Oh, very good. So if I were to ask you what makes a perfect clerk, like when somebody comes and rotates with you, what are you looking for from that student that would indicate that they would be a great resident going forward? Lexi, if you want to take that.
So I think that a few words come to mind for us, and especially, for me, it would be a team player for sure, and someone who is teachable. When we have a student who comes and really finds their way to be a team player and work well in our team, that's someone that we want, because then we get the idea that, that's how they'll be, and it reflects how they would be in our residency program. And then teachable, we understand that you may come to our program with different knowledge bases, and you may not know, we know you're a student, you don't know everything at that point. But if we teach you something and go through radiographs or a surgical procedure, it's wonderful to see when students are able to absorb that material. And when we bring it up later on, if they still have that knowledge base or have even dived even further into it in the literature, that really impresses us.
Absolutely. Sara, what qualities are you looking for?
I mean, I completely agree. I think being teachable is very important. I mean, we can teach you how to be a good surgeon and how to be a good podiatrist, but we can't teach you how to be a good person. So kind of like Lexi was saying, it's, seeing somebody who wants to be there, who wants to put in the time. Again, we don't expect you to know everything. I know that I don't know everything, but if you don't know something, just putting in that extra effort of going in and looking it up the night before and saying the next day, hey, can we talk about this? Or let's have a conversation about that. Just a little bit of effort, I feel like, really goes a long way.
Effort word is always at the top of the list too. And teamwork and getting along with everybody. Absolutely. Cara, do you have anything to add to that mix?
I think just the only thing to add, going along with the effort, like going into surgeries, a lot of times as a student, you're just going to stand in the back because that's what your role is that day. But coming in as much as you can, roughly knowing what's going on, so that when you peer over on the end and try to see what's happening, you kind of know what's going on. You can ask questions afterwards, trying to be as engaged as you can. It really shows that you're trying to learn.
Absolutely. Words of wisdom for students that want to rotate at KSB. That's excellent. So on the lighter side, you all seem to get along really well. What do you do when you're not working at the hospital? Do you all get along and do social things together?
Absolutely.
Yeah.
Tell stories.
So I mean, we'd have game nights together. We one time went over to Sarah's house last year and got a good group together for a game night, and that was one of the most fun nights we had. It's just fun getting together and laughing and talking about things aside from work.
Yeah, our director is part of a band called Off Call. And so was it a couple with other physicians as well. So it's definitely named appropriately. So a couple months ago, he performed for the KSB Foundation. So we all got to go and support him, and we all made matching T-shirts with his face on it. So that was really fun.
That's fun. Groups that like working together, like doing things outside of work time together. So, and I think, at the end of the day, I think it gives better patient care for continuity and things. So I commend all of you on that. Before we talk about other things, Lexi, do you mind talking about being a third year and going into a job search? I know a lot of students and residents ask me, what's it going to be like? When do I start looking for a job? What can I expect out there? Do you mind sharing your story to date?
Sure. So, been trying to decide what route I wanted to go, whether a hospital job or private practice or a group or even a fellowship. But what I really feel drawn to is a hospital job. I think it just has the benefits and the work type that I am looking for. And so probably, maybe about 5 months ago, I started looking just kind of, I'm from Oklahoma. I wanted to see if there were any job opportunities going on. I tried to connect with people that I know in the area. They say connections and networking is the best way to find a job. And so I went back to the podiatrist that I know and family friends, but I ended up seeing a job online for a position near where I'm from. And so I applied for it, and I thought, well, I'm still over a year out, so we'll see if they even consider me. But I got fortunate enough to interview with them, and I ended up flying to Oklahoma and having an on-site interview, and they said they would love to have me. And so they offered me the position, and I most likely will be taking it. But yeah, it's definitely about getting your name out there, networking. We ended up having mutual family friends whenever I was speaking to the podiatrist that's already there. And so it worked out well.
Well, that's fabulous. So you are just beginning your third year of residency and you locked down a job already. That is awesome. Congratulations.
Thank you. Thank you.
And then, so when you go into that position, are your privileges delineated already, or does that all just come in the future?
Yeah, they've sent me what my privileges will include. I haven't signed the official contract yet, so we'll be getting to that stage soon. But yeah, they've let me know what the salary will be and, the benefits and such. And so, yeah, I have an idea.
Well, that's fantastic. Congratulations.
Thank you.
So Sarah, that time's coming. What are you hoping to do when you're done with the residency program?
Yeah, I am really hoping to do a fellowship after program. I'm done with the program. I definitely do not think that we need a fellowship graduating from our program. I've got a couple different reasonings for wanting to do one. I kind of feel like that's the trend that our profession is taking. And I want to be able to say, I did everything that I could to make myself the best. I do think when I do things, I do them 100%. And I want to make sure that I put 100% of myself into being the absolute best surgeon that I can be. And I really feel like that would be a great opportunity. And I'm starting to look into that right now, and we will see how that goes.
Oh, very good. It's never too early to think about that. In our profession right now, it's kind of divided. When I talk to residency directors, they often say, if you've got 3 years of great training, you're ready to get into the workforce. And if you have opportunity like Lexi has, you got to take it. On the flip side of the coin, I have other, like Dr. Steinberg out at MedStar says he's recommending all of his residents find a fellowship. So I don't think you can go wrong either way right now, especially if you're getting great training during the program you're in. Well, that's fantastic. Where do you hope to settle someday, Sarah?
When I'm all done with everything, I really hope to go back to Colorado. That's where I'm from. That's where my family is. It's where my husband's family is. I don't really care where in the state I go. I just want to be by the mountains. I miss the mountains.
In kind of tangent here, but my son and my daughter-in-law and their 2 kids are moving from Boston to Colorado next week.
Oh, awesome.
So they're going to make the move. They're going to live in Loveland. So that's good. So Cara, how about you? You went to school in Illinois. You went to podiatry school in Illinois. You're doing residency in Illinois. Where do you want to live someday?
I've had a good time here so far. I feel like, my whole family's here. My husband's family's here. It's just home. So somewhere in the Chicagoland area is where I'd like to be.
Fantastic. Well, that's excellent. All right. Well, I wanted to just take a couple minutes and pass along hi from all the faculty at the Arizona College of Podiatric Medicine. Dr. Jenkins said, you better make sure you tell them hi for me, and Dr. Dialan and Dr. Tom. So everybody's so happy that you're doing well in Illinois, and everybody's interested in following our graduates' careers, and everybody's proud of you, Lexi and Sarah. So great work, and Cara the same. I mean, if you're working with Lexi and Sarah, I know you're doing well. So congratulations. And any other comments? What would you tell a prospective student in an undergrad who's thinking about going into podiatric medicine? Cara.
I would tell them to explore all of their options. That is what I did. And podiatric medicine is special compared to a medical school in that once you're in it, you're committed. And so making sure that you want to be committed, that would be my advice.
Well, it's interesting because you went and shadowed doctors and they told you shouldn't go into medicine or podiatry. And you did anyway. I mean, that's not the usual course, Sarah, what would you say to a prospective student who's thinking about going into podiatric medicine?
I would say shadow. I think shadowing any specialty that you are interested in, getting the wide breadth of it, and also just talking to current residents, current students, I think that's really helpful as well. Just getting as many opinions as you can, and then trying to make the decision as what's best for yourself.
Absolutely. Lexi.
I feel the same way. And, but also if you're around KSB area, come hang out with us and we'll make sure you have a good time and you'll love podiatry after this. But I think, yeah, shadow all different types, see what you like. But if you enjoy surgery and you enjoy helping people, podiatry might be for you.
Absolutely. We're starting up. All the 11 schools and colleges of podiatric medicine are getting involved in a student recruitment campaign called Feet on the Street. And what we're doing is we're going between the 11 schools, we're going to 220 undergraduate institutions, introducing them to podiatry. And then a lot of times we're going to connect those universities with residency programs. So I'll make sure, I'll talk to Dr. Wu and we'll make sure people come and visit KSB for sure.
Awesome.
Awesome.
All right. Very good. Well, thank you so much for taking time out of your busy schedules. I know it's a Thursday night and you probably got a lot to do, but I wanted to also say, I'm going to be sending each of you one of these Dean's Chat cups, and look forward to following your career, of course. And to all of our listeners out there, if you're on Spotify or Apple Podcasts, please give us a 5-star rating. And of course, if you're on YouTube, we'd love for you to be a subscriber too. So this episode we'll put it up in a couple weeks, and I'll make sure you get to see it beforehand. But thanks again, and bye-bye, everybody. Cheers.